Okay, so in this session, we're going to review the toolkit that we've been discussing throughout the conference, and so that all of the materials are in that flash drive. So we'll review the contents of the flash drive, and then we'll also give you a demonstration of the website and where you can also access all of the different resources, and where you can direct staff or your coworkers to also access the resources there. So do you want to go ahead and... We should do some introductions. So I am Esmeralda. I'm the project manager for the CPIC study, and I will be co-presenting with Mariana. We've been working on this website, and we hope that it'll be user-friendly and that you will be able to find helpful resources there.
I also want to introduce Jim and Elizabeth, which you've met already, and they'll be doing an activity at the end. So our presentation will go from briefly reviewing the contents of the flash drive, which you just received, to doing a short demo of the website and looking at how to access resources and share those resources in your agencies, to then discussing the collaborative care model with Jim and Elizabeth and doing an activity about trying to visualize what pieces of collaborative care exist in your agency today, which pieces could exist, and which pieces you think you'll be referring out. So do you want to get started with the flash drive?
We want to do some introductions.
Yes. Well, we'll get started with introductions. I'm Mariana. I'm from RAND, and CPIC brings me here today. I'm going to ask that each person in the room either tells us your name, where you're coming from, your organization, what you do at your organization. I'm a research assistant at RAND. And then tell us something either about what brings you here today, why you thought this was important, or some way that depression has touched your life. Because if the statistics are correct, just about everyone in this room has a story to tell about it. So.
Hello, my name is Mary Hernandez. I'm with East Los Angeles Women's Center. I am the weekend advocate for our sexual assault component. I go to county hospital when I am called. So I do get to see cases that basically are walk-ins, or they're brought in via ambulance or law enforcement. So I also need to collaborate with the nurse, the police officer. Perhaps if they are also have come with a social worker. Between all of us, we can pretty much pick up on something. If we think that perhaps this person should go to a hospital instead of being sent home, then, we're there for them, and we can make that decision.
Good afternoon. I'm Josefina Dungana. I'm with the Palmdale Mental Health Center. I'm a clinician there, and with the Department of Mental Health, LA County. And what we do, of course, is work with patients who come to our door. Right now, we are changing. We're no longer seeing only severe and chronic patients. We're also doing a crisis resolution group, which means we provide short-term intervention to people who are under stress, have adjustment issues, and anything that doesn't fall into the severe and chronic. So that is good. We're moving into that, into field-capable services, meaning we're going to the areas. You know how Antilla Valley is. It's so just out there. I mean, yeah, it's so far away, limited resources, so scattered too. So we have a lot of communities that come to us, and now we realize we need to go to them under MSA funding. So we're excited about that. It's a new thing, so we're still, how it is with the county. You go under rules and regulations and blah, 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 and protocols and all that. So we're still, struggling with that, but we are excited about that new model that we are doing. And depression is something we see a lot these days, especially when we changed our model beginning July. People started coming to us. I mean, we don't realize the magnitude of the problem unless people come to you and present themselves in, a lot of ways that they are just so down there. And, we're just happy to serve.
Great. Thank you so much. Do we want to pass it to the gentleman?
Well, good afternoon, everyone. My name is Jose Reyes. I'm here on behalf of Programa Mano Amiga, which is a partnership with USC, the School of Social Work. And I'm here because I want to find out what are some other treatments that are available out there for individuals. We particularly serve older Latinos with major depression. And so I'm looking at different varieties of services that are out there, as well as how can I help build a better and more efficient coalition with individuals or agencies that are already providing services to the population.
I'm Susan Stockdale, and I'm at UCLA. I work with Mariana and Esmeralda on the academic side of CPIC. And, working with the research team, we each have our own little duties that we're concentrating on. And I know they've been working on this website, and I've been very curious to see what it looks like. So I wanted to come and see what are the resources in CPIC and what does the website look like and how are people going to access things.
Hi, I'm Paul Gore. I'm a clinical psychologist, and I'm the Director of Behavioral Health at the Saban Free Clinic. We have a very large behavioral health program there. We have an integrated model with our primary care physicians and our medical staff, and depression's the number one diagnosis of the patients we see. So just very interested in learning more about CPIC and the toolkit.
Hi, everybody. My name is Marisol Aguilar. I'm actually a parent advocate, but I'm not going to say the organization because I'm here without permission of them. But I'm a volunteer in our community as well. I'm here actually as a parent of a depressed child. I also work within the community, and the community is also depressed. So I am here to actually try and do a change in the community.
Okay, so I'm Andrea Jones. I work for Healthy African American Families, otherwise known as HAP. I'm also part of the CPIC project, and today I'm going to just be taking a few notes on this particular session.
Hi, I'm Susan Hirsch. I'm a volunteer at UCLA, and I became involved with this project because I think it's extremely important, and it is my pleasure to be able to assist with it.
Hi, I'm Franz Jordan. I'm the Director of Mental Health for Children's Bureau. We are very interested in collaboration. We've had family resource centers for many years. And our contract is basically children's focus. So I am hearing more about the opportunities to work toward looking at alternatives for the parents that don't meet criteria and are in desperate need of services. In terms of how depression has touched my life personally, my father was hospitalized for a decade at Metro, so with involutionary melancholia. So depression has indeed touched my whole family's life for a long time, and I think we're still suffering from the effects that come way down the line.